about stroke. Stroke is a disease which happens in a brain, which is kind of like heart attack, but not in the heart's coronary arteries. It's actually when a blood clot or an embolus. There are two types of stroke: hemorrhagic stroke and ischemic stroke. The most common type is ischemic stroke. First, when in a healthy artery, blood gets supplied to all parts of the brain, making the brain nutrient rich and healthy. Our brain consists of 20% of the oxygen that gives it its amazing power. The brain gets energy to process pains, aches, and all sorts of things in our daily life. But if we get a stroke during ischemic stroke, which I said was the most common type of stroke, in ischemic stroke, a vessel gets partly blocked, or it gets fully blocked by a clot or a thrombus. And the clot is big enough to stop blood flow to the nearby, all the nervous cells in that area. It will die, and then the brain's condition will become worsened. In hemorrhagic stroke, there are two ways. In another stroke called hemorrhagic stroke, there are two ways. One, through an embolus. Two, through an aneurysm. An embolus is a blood clot that forms somewhere in the heart, in somewhere in the body, like the heart aorta, which supplies blood to the whole body. It then goes to the carotid arteries or the front to the arteries supplying the brain, such as the carotid arteries, and blocks the blood vessels enough to fit in. Then oxygen supply is cut off for that part. Then the aneurysm way is an aneurysm. Our brain's arteries dispense into smaller arteries, which create the circle of Willis. But if there is an aneurysm in the circle of Willis, it will surely rupture. So this is a medical emergency and you need treatment immediately, or else if left untreated, this aneurysm in the circle of Willis or any other part of the artery can cause pressure to be built up on your skull. The heart covering like a snail shell surrounding your brain. So you'll experience migraines, which is a type of headache, and sharp piercing pains inside your skull. So this is going to be a medical emergency. There are two ways of treating ischemic stroke and hemorrhagic stroke. One, through TPA, called tissue plasminogen activator, and TPA for short. TPA breaks up the blood clot and allows the blood to flow. But in other serious cases, when the clot is too hard to treat, with the tissue plasminogen activator, or doctors will stop tissue plasminogen activator because the patient is on certain medications like aspirin or ibuprofen or any other medication. Or if the clot is big, they will respond to the process with the surgery procedure or process called endovascular thrombectomy. Endovascular thrombectomy is performed when surgeons inject a fluorescent dye and it illuminates the brain's arteries, and when a black patch appears, you found the blood clot or embolus. First, doctors insert a needle into the leg or the arm and then bring it up to an artery in the brain. Then they insert a catheter, and then they insert a thin filament which then constricts the blood clot, makes it small, teeny tiny like this. Then the surgeon pulls it out, and then oxygen flow is revived through to the brain. Thank you.